Okay. Buenas and half a day. Thank you everyone for being here. The Committee on Education, Self-Determination and Historic Preservation, Infrastructure, Border Safety, Federal and Foreign Affairs, and Maritime Transportation will now convene this virtual roundtable hearing. Today is Tuesday, October 5th, 2021, and it is currently 5:05 in the afternoon. For the record and in accordance with the Open Government's Law, public notices were sent via email to all senators, stakeholders, and all main media broadcasting outlets on Tuesday, September 28, 2021, and on Saturday, October 2nd, 2021. Notice was also provided on the Guam Legislature website. Joining me today are Senators, the Acting Vice Speaker, Senator Amanda Shelton, Senator Mary Camacho Torres, Senator Sabina Perez. Okay. I think that's it. Thank you, Senators, for joining us for this hearing. We'd like to proceed with some general rules of conduct before we begin. The rules of conduct and quality assurance standards are as follows. Please keep video on at all times and ensure you are in a room with little interruptions and adequate lighting, specifically to make sure the participant's face is visible at all times. The host of this hearing will mute participants until called upon by the chair. And when called to speak, please unmute yourself and speak into your microphone. Please ensure that you also indicate your name and perhaps your job description that you hold in regards to the agency we are addressing. Members of the committee wishing to speak may indicate via the in-app feature chat box, and we can call on you. Individuals testifying shall first be recognized by the chair before speaking and shall state their name for record-keeping purposes. Okay. Senators will be allowed to pose questions. Questions and testimony shall be confined to the substance or nature of the agenda. Personal inference as to the character or the motive of any senator or any individual testifying is not permitted. Any violations of this general rule of conduct will result in removal from the hearing by the host. Okay. So good afternoon, everyone. We've called this virtual roundtable hearing to provide our community an update of the Guam Department of Education and the opportunity to participate in dialogue with the department regarding the reopening of public schools and the issues that had come up in the process of preparing for the return of our island students to our schools. Due to the ongoing challenges of the COVID-19 pandemic, Governor Lou Leon Guerrero signed Executive Order number 2021-21 relative to suspending in-person learning on August 27th. In response to this executive order, all public and private schools serving pre-kindergarten through 12th grade suspended in-person learning on August 30th of this year. The resumption of in-person learning and the reopening of the schools were allowed upon the signing of the Executive Order number 2021-23. Effective September 20, 2021, in-person learning in the school campuses were allowed to resume, and the schools were required to submit their reopening plans to DPHSS no later than October 1st. The schools were encouraged to open when they were confident in their preparation and safety measures for the return of their students. And then our second item on the agenda is to address the concern from current stakeholders of the current edition of the Student Protocol Assessment Manual, also known as SPAM, which is the guiding document in which school counselors refer to when working with students. Today's hearing will discuss the letter that was sent to GDOE regarding stakeholder concerns on the suicide risk assessment of students, which was sent on September 2nd, 2021 by my office. Today we received a provided response, yesterday we received a response from GDOE. So we can also discuss the response today. Okay. So we will begin with the update on the plans of the reopening of the schools, GDOE's plans for the school and modes of learning moving forward, and the efforts GDOE is making and will continue to make addressing issues caused by COVID-19. Before we begin, I want to thank GDOE, everyone really for the enormous amount of work that you've been doing for over a year. And really a lot of the unknowns that we have to face as a community with COVID, you've been very proactive. You've worked very hard to ensure safety, provided mitigation factors in there. And we're really grateful for the amount of effort that you've or the long hours that you've worked to bring our kids back into the classroom. I know that a lot of the things are beyond your control, but I've seen your proactive measures, especially within the schools, amongst the teachers and the staff, and of course with the guidance of the principal and the superintendent. Great job. I know it's not easy, and I will continue to support everything that you need in regards to this COVID-19 pandemic and the adjustments you'll have to make. So with that being said, I'd like to acknowledge our superintendent, John Fernandez, and I don't see we also have Mrs. Gutierrez, who is a member of the board, and our deputy superintendent, Mr. Joe Sanchez. But thank you for being present today. So Mr. Superintendent, we'll start with you.
Okay, thank you, Senator, and thank you, members of the committee. Let me, if I could, go ahead and recognize Ms. Maria Gutierrez and Ms. Feli Angel from our board. I don't have all of I can't see everybody on the screen, but I know that our Island-wide Board of Governing Students members are also present today, so I want to thank them for joining us. We do have our deputy superintendents, who include Deputy Superintendent Erica Cruz, Joe Sanchez, and then Acting Deputy Frank Cooper Nurse, who oversees finance and administrative services. Also, just because we have a lot of people online, I'd like to if you just give me the opportunity, Mr. Ike Santos from Federal Programs is on. We have Ms. Nadine Cepeda, who is our district school psychologist. We have several administrators, Ms. Marianne Lujan, principal of Jose Rios. I see Ms. Julie Salas, OP Elementary, who are part of our operations group, who have helped to navigate us through COVID-19. I do recognize also Ms. Doris Bucacosa, who has been a key member of that operations team in terms of the supplies and equipment needed. Try not to leave anybody out. I know we have a group of our school guidance counselors also present, and I know that they're eager to hear and discuss some of the concerns that were raised earlier by you, Senator, in your letter to me. Let me also recognize Simon Sanchez High School principal, Ms. Carla Nayan as well, also an instrumental member, and Derek Santos, principal of IMS. So we have a large team here, and it's just because the efforts that are underway, that have been underway, have taken a real team of people to help answer all the questions that have come up with regard to COVID-19, and again, come up with the solutions and help implement the measures that have been taken to get us through the last 18 months, almost, I guess 18 months, and hopefully, not going on 2 years, but soon will be 2 years of navigating this pandemic. I know the subject matter was really related to the reopening of schools, but I wanted to just maybe go a little bit further back to when we reopened this summer, because a lot of our planning really gets centered around reopening for the school year. And I've submitted testimony to this effect, so I will try not to read word for word, but I did want to cover some basic points that we could use for later discussion. And I think it's also, again, thank you again for having an opportunity for the public to hear this information as well. As you are aware, all 41 GDOE schools were open for the first day of classes on Thursday, August 12th. Unlike last year, this year we had planned to offer 5 days of face-to-face instruction to at least 85% of GDOE students, with the other 15% already registered and enrolled in the online model of learning, and that registration took place back in May of 2021. We were able to open up from August 12th until August 27th, when the governor suspended in-person learning as a result of the new surge in COVID-19 cases within the community. As part of our reentry strategy, I wanted to emphasize, because this will be our continued effort, is that we do, we have prioritized a layered mitigation approach to COVID-19 within DOE schools. This is in line with the Centers for Disease Control framework, as well as with the guidance from Department of Public Health and Social Services, which outlines a number of measures that work together to increase the safety at schools. These include ensuring that you stay home or you keep your child home if they are sick or show any symptoms that could be related to COVID-19. It requires universal mask wearing for all employees, students, and visitors on campus, frequent hand washing and proper respiratory etiquette, frequent cleaning of high traffic surfaces within schools, physical distancing of at least 3 feet within the classrooms and at least 6 feet in cafeterias and common areas where possible, adequate ventilation, vaccination for all eligible individuals on campus, and then contact tracing, quarantine, and isolation in the event of positive cases on campus. So the reason why we want to reemphasize the layered approach is because we're not doing one or two of these measures. We're trying to implement all of these measures so that if one is deficient, you have several other layers of safety or mitigation measures in place. And this is the recommendation by our health experts with regard to school reopening. And it's something that you will see in schools that you will not see in many other places in the community. And then this will be our continued approach. And we want to thank you, members of the legislature and others, for allowing Guam not to be caught in what other districts and other states have been caught in, which is political debates about the use, masking, and so forth. So what we're doing really is, I believe, a combination of proven safety measures that we want to continue. When we reopened on August 12th, I wanted to comment that schools did a good job implementing the prescribed safety measures and making adjustments to their operations where they were needed. Now, clearly, this was the first time we were bringing all of our students back, so there were many adjustments that needed to take place. And in fact, when we started off the school year, all schools saw that more students were riding with their parents and getting dropped off versus riding the bus. So just from day one, just having to adjust the car rider lines and the bus lines were some of the major adjustments that had to be made in order to facilitate the quick entry of students into school while also screening them and so forth. So, in that first week, while there was some noise about, the return to school, our principals and their staff really did a good job of observing what was happening, making the adjustments from day to day. And within the first few days, we really saw a lot of improvements in the operations in the direction of more safety for our students. I want to emphasize that things like universal masking was observed throughout the campuses, as well as hand washing, hand sanitizing, cleaning, and so forth. We do want to recognize that there are and were areas of concern, and those really were in the common areas. During lunch, recess, and bus pickups, where distancing between students is more of a challenge due to a shortage of staff and a shortage of areas at some schools where students could congregate comfortably. So schools have responded by creating multiple lunch periods, offering areas to sit and gather, and setting up cafeterias, as safely as possible. In those first weeks, Public Health and Social Services sent a team, and that team included Director San Augustine, his deputies, as well as some of his lead, health advisors. They walked with us through about 12 schools prior to the shutdown, and were able to observe the areas of strength and identify areas of needed improvement. And again, I think we shared the same observations that there were things that worked really well, things that we saw improve from school to school, and then areas that, of course, we need to continue to monitor and address going forward. Not just the common areas, but we also heard concerns about bus transportation, which we know Department of Public Works was made aware of and has had to address in order to calm the concerns from parents about the safety of bus transportation. Despite the measures to provide safe school operations, the situation in the community was not safe. And according to the COVID-19 statistics following the relaxation of restrictions on July 30th. So by the time classes started on August 12th, cases had already begun to climb, with the 7-day total of new cases per 100,000 individuals exceeding 100, which essentially placed Guam in high risk as early as August 7, 2021, based on the CDC Community Transmission Risk Guidelines. And so in the testimony, I know you can see a chart illustrating, the number of new cases over time, as well as the positivity rates. That line, that black line that goes across at the lower part where it says 10%, that is essentially the high risk category under CDC. So if you cross that line and go above it, based on the CDC risk level, you are in high risk. And you can see, where both lines crossed and, still remain over. Again, going back into July, we were hovering near 0%, and you were hovering at such a low number. But once we hit July 30th and the restrictions were lifted, we started to see what has essentially been a new surge in cases that we are still struggling to address. Now, we can probably pin the peak of this recent surge somewhere in mid-September, and after that, you can see the cases coming down, but they've seemed to flatten and plateau, over this last week. So again, this is something that this is basically taken from the JIC numbers on a day-to-day basis, and we pull those numbers and we run our own charts to see if to make sure that we're monitoring the trends as well. And as you can see, August 12th, when we started, was the start of the surge. When we suspended school, the in-person learning, it was toward the end of August. You still saw that peak happen and start to turn before we began face-to-face cohorts on September 27th. In those first 2.5 weeks, again, we reported cases in an effort to ensure transparency. So one of the things that was very challenging is that even if these cases were not shown to be coming from the schools, in essence, they were coming from the community and coming from the homes and showing up at schools. We were reporting them anyways because we wanted people to know if we saw a positive case at a school, we wanted to make sure we reported it. And in that time period, about 109 cases were reported at a variety of schools, roughly 0.5% of face-to-face student enrollment for all the schools that have reported cases. We have had very extensive discussions with the Contact Investigation Unit at Public Health and with their leaders, because it's our concern is if there is ever evidence of a link between cases at the schools, that's something that's very important. I don't think we're going to be able to realistically prevent a kid who's positive or an employee who's positive from showing up to school or to work, especially if they don't have symptoms and they don't have any reason to believe that they are COVID-19 positive. But of course, once students or employees find out, we immediately implement our protocols, which means that our school administrators, school nurses begin the process of working with public health to do contact tracing, to quarantine those who need to be quarantined, tested, and cleared before the student or employee returns back to school. So based on all those 109 student cases, and according to public health, there has not been any evidence of spread within the schools. And in fact, what they've been able to trace these cases back to are events at home or events in the community, which was the concern. Now, even though we take pride in that, we do take pride in the fact that there was no spread in schools in those first couple of weeks. For every case reported, our administrators, staff, nurses work diligently, urgently to begin contact tracing. And with the number of cases that come to the schools, those increased efforts associated with COVID-19 response have taxed our school staff tremendously, and resulting also in increased absences when employees or students are required to stay home. So even if from a health perspective, we're not seeing spread within the schools, there was a lot of activity going in to respond, contact parents, track these cases. And we have seen, the impact of that on our staff. I mean, it's a tough job. It requires, a lot of communication, even on the weekends and the evenings, to try to make sure we address each case as urgently as possible. The suspension of in-person learning took effect August 30th. And as you know, what we did in making that shift, because we found out about that on a Friday, and it really wasn't realistic to be able to implement a full shift to remote learning the following Monday, not with the size, of our organization and of our school population. But so what we did is we took 5 professional development days from later in the school calendar and moved them into that week. Because we wanted to use that time to distribute laptops and MiFi devices to students and families in need, as well as to work to ensure that teachers and administrators were clear on the process for switching to 100% online. We were able to start that on September 8th after the Labor Day holiday and continue that until September 24th. So coming back, on September 16th, the executive order 2021-23 was issued, reauthorizing the resumption of in-person learning. And in that, Governor Leon Guerrero allowed the schools and the school districts and the private schools and charter schools to determine when and how to reopen. And I think what you can agree on is you saw many different strategies for the many different schools. DOE actually basically chose a day to start, which was to close out online instruction on the 24th and begin on September 27th. September 27th, we also used the time between the 16th and the 27th to organize and inform our stakeholders that we were going to resume in-person learning in cohorts. Now, based on the CDC community risk framework, Guam remains in a high-risk situation. Now, that doesn't mean you have to go and close the schools, but it does mean that when community transmission risk is high, it's high everywhere. It means that if you're in a restaurant or you're at school, you're in a hotel, you're somewhere out in the community, because it's out there so prevalent in the community, the likelihood that you may encounter someone who has COVID-19 is going to be very high. So in following that high risk assessment, we determined that in order to mitigate the risk of transmission in schools, we wanted to return to in-person instruction, but to do so in cohorts, which meant that school populations are essentially divided in half alphabetically, and the 2 groups alternate days on an A schedule throughout the week. Now, this approach, unfortunately, reduces instructional time for the in-person students, but we consider this to be a temporary interim approach that will hopefully allow for students to eventually resume classes for 5 days of instruction once the community transmission risk subsides. So again, the current cohort approach, I believe, has enabled us to start our schools back with face-to-face instruction while allowing for more distancing on campus while the community situation is still problematic. So I want to recognize that that's the plan is that this is a temporary strategy. We do not want to extend this if it's not necessary. And our eventual goal is to return to 5 days of instruction, but it's going to take a community health improvement for that to take place. As a side note, I want to just note for the legislature, this does mean that we do have to come to the table to address the mandate for instructional hours as well as service learning, given the fact that this pandemic has extended past our initial efforts to address this back in March of 2020. So now we're in another school year where we need to take a look at that. So we would like to work with you to address, both areas and any other area that you feel has been impacted by COVID-19. Now, as part of our return, we do continue to provide PPEs through federally funded PPEs, such as the face masks for all employees and students, hand sanitizers, cleaning and disinfectant, electrostatic sprays, temperature monitors, and other supports. But we also use the time that we had to address one of the common concerns that we have with public health with regard to the cafeterias. And so what we are doing in the cafeterias, because those are the only places that students have to take their masks off to eat, is we are now midway through the installation of sneeze guards on our cafeteria tables in our schools. And so that is ongoing and will be completed sometime later this month. We are also anticipating a shipment of approximately 200 or more, probably heavy duty canopies, and along with tables and chairs to facilitate physical distancing outside of the classroom and in the corridors or outside of the corridors during the breaks. Unfortunately, our vendor has reported some delays in those shipments, but we are continuing to monitor so that we can distribute these items as soon as they are delivered. I think shipping delays have been a common issue, not just here in Guam, but elsewhere. And again, Doris Bukakosa is on. She's our team member that it constantly calls the vendors to check in with regard to those deliveries. And then finally, we are in the process of resoliciting for the HEPA filters for all the classrooms. As you know, this summer we put out a solicitation for HEPA filters, but that encountered a vendor protest. And in what we did is we worked to resolve the protest, so we restart the process. And so at this point, we are preparing to resolicit within the next 2 weeks. As part of the reopening, I think the community has also heard that one additional measure that has been added is the screening testing plans. Now, this has always been a recommendation from the CDC. I think, unfortunately, the word about the screening testing plans came out around the same time as the deadline for employees to fulfill the vaccination mandate. So when we heard concerns about screening testing, parents were asking why, whether students were now mandated to be tested. And it's a completely different strategy that we need to work on and take time to work on in order to be able to communicate with our parents and stakeholders prior to implementation. So I just want to use this opportunity to assure our community that there are no plans to immediately start testing students randomly without informing parents what this process will entail and ensuring that everybody understands what's involved, including requirement to get consent. So I just wanted to put that out there because a lot of questions we had to do with a mandate on students being tested, and it's not quite the same thing. So we are working, though, to develop that screening testing plan. We have trained, I'm saying 114 employees, but I know Erica can correct me if that's wrong, but about 114 employees were trained to be able to conduct Abbott Binax Now rapid tests. And our first area of focus will be on those who require weekly testing. We like to make the weekly testing of our employees, for instance, under the vaccine mandate. If they choose not to be vaccinated, they can submit to weekly testing. We would like to be able to do that at the schools rather than have them leave school and to go to a government designated site off campus. We think it can be easier facilitated and more convenient, and I think that's the process that will be more successful. So at this point, we are waiting to confirm, the delivery of test kits. A sufficient number of test kits so we are able to plan. We are working on getting the authorization to utilize DOE schools as designated test sites because, for all legal and liability reasons, we want to make sure the proper authorizations are in place. And we also need a standing order from public health that will allow our school nurses the authority they need to supervise and administer testing at schools. So those are pending items. But once we get them, we will be able to implement school-based testing for our employees who have opted for weekly testing versus the vaccine. Again, I mentioned that in the latest guidance memo from public health, there was a requirement to prepare a screening testing plan with a target of doing a random testing of at least 10% of our student population on a regular basis. So at this point, we're continuing to research and discuss the student testing plan with public health. And then our plan is to, of course, share this with the community for their input information prior to any implementation. So the time frame is 90 days to try to meet this target, but it is going to take some time for us to to finalize a plan that takes into account the stakeholders' input and information. Now, I mentioned the vaccination mandate. So in addition to the safety mitigation measures, the other strategy was to maximize vaccination where possible within our schools. So right now, according to our data that we were able to collect this week, first of all government of Guam employees are required to be fully vaccinated by September 24th. So after we hit that deadline, we immediately had all of our schools compile and submit that information to our Human Resources Office, which is charged with maintaining compliance records for our employees. So of our 3,459 employees, we currently show that 3,063 or 88.5% are fully vaccinated. 97 of them, of our employees, which is 2.8%, have at least received one of the 2 required doses of either Pfizer or Moderna. And then there are 152 who have reported that they are not vaccinated at all. There are also 147 or 4.2% of our employees who have not yet submitted their forms. This doesn't mean that they just refuse to submit the forms. I believe that we are, scrubbing our records to ensure that we are taking into account all the employees who are currently on long-term leave or on military leave, or if they've recently retired. That information will need to be updated. So we are working to update and clean that information. But at this point, it looks like we have about 249, 7% of our employees who require weekly testing. Again, that includes those who've only received the 1 dose because they're not fully vaccinated, and then those who are fully unvaccinated. Just 32 employees, which is a very small percentage, have indicated an unwillingness to submit to the weekly testing or to get the vaccination. So we'll continue to work with our employees to make sure we meet the compliance requirements. And of course, we'll be happy to keep people informed as to our progress. But I do want to say that it is 89% of GDOE fully vaccinated. Is a pretty good result in terms of hitting that 80% target and exceeding it for our agency. And so we will continue to work with our employees, inform them of the status of the vaccines, the benefits, the risks, and allow them to and hopefully make the decision that they feel comfortable with. We do understand that booster shots are now available and that frontline employees are eligible for those booster shots. The frontline employees do include school-based employees. Unfortunately, we're just talking about Pfizer. So those employees who received the Pfizer vaccine would be eligible for the booster. And we will put out information to our employees to clarify that point and to facilitate their access and opportunity to receive the booster shot. So again, I included, you can see a pie chart that kind of just goes through the share, but again, 89% of our employees are compliant. I think that's great news for our school system. We are continuing, we don't have the full information compiled on student vaccinations as they've been submitted, through from parents to our schools. So right now, what we are continuing to use is the community-wide numbers. So if you can see the chart right now, community-wide, the government is reporting 88.3% of eligible residents that are fully vaccinated. So this breaks down into a 91% vaccination rate for eligible adults and 66.2% vaccination rate for children 12 to 17. So we have facilitated vaccination clinics in the past, and we will continue to do so to support this vaccination effort for our employees and our students. But at this point, this is what the community data shows us. Once we get the school level data, we'll be able to determine whether there are issues regarding access to the vaccines or other barriers to access that we can work with public health to address. We have heard that there may be an approval of the vaccine for children under the age of 12 coming as early as the end of October. And if that is the case, we will continue to support vaccination efforts for our students. And I know for many parents, they will be happy to hear that news. So again, at this point, the reopening strategy is, we are focused on cohorts, and then we will, again, we are planning for the hopeful subsiding of the COVID-19 risk in the community, so we can go back to 5 days of instruction for all students. But as part of our planning, we've had to plan for both, to go in both directions. So either things get better and we can move into 5 days of in-person instruction because of the fact that our safety measures are in place. The data shows us that we can safely return more students to campus. The vaccination rates are up and the community cases are down. Those would give us a great opportunity to move forward with the return to school. We of course have had to adjust in the other direction as well. So if things get worse, our priority really is to continue to allow some form of in-person instruction. So we have been working with the governor and public health to continue to encourage that if under any scenario, we would like face-to-face instructions to still be an option, even if we have to reduce the cohort even further. We do think that face-to-face instruction is going to be key and does not have the same, online learning does not have the same benefits for most students. However, should there be a turnaround and there is an absolute requirement to shut down, schools again, we've already gone through the drill, multiple times with regard to distributing laptops, moving from in class to online instruction. Our teachers are prepared and trained to do so. And even though we would like to avoid that, we are prepared if that is necessary, in the near term. Hopefully it won't be the case, but we are prepared to do so. Going forward, again, I just mentioned our approach and our work with the governor, public health, the education board, and all of our stakeholders to make sure that we are able to continue to discuss our plans and to receive input on our plans. We have been focused on trying to get to a point where we can maximize our strategies to address learning loss. So we have been purchasing the supplies needed. We have been purchasing instructional materials. We have been planning for the implementation of a variety of before and after school activities to help our students, in the recovery and acceleration, of that learning recovery. Now, the challenge is, as long as we're not able to have them face-to-face in school, it becomes harder to deliver these strategies, but we will continue to prepare ourselves for that opportunity. And with the federal funds that are being deployed to support that, we will continue to focus on getting back to a point where we can focus on the learning impact that the shutdown of schools has caused. So with that, I'm going to go ahead, and I think that's been a good overview of where we've been and what's ahead. And we just wanted an opportunity for the community to hear the presentation. And of course, we're happy to answer any questions that you might have regarding our strategies. So thank you, Senator Nelson and committee members.
Thank you, Mr. Superintendent. I appreciate the breakdown that you provided to the committee. And then also we posted your testimony here in the chat for everyone to access and read. Some of the concerns between some of our stakeholders were that they felt the ability to return back to the school was, the timeline was a little bit uncertain, right? And so, and we discussed this as well. Once they started to say we needed to shut down the schools, then there wasn't a definite timeline or a definite time space that says, okay, we'll shut down the schools, for example, we'll shut down the schools for a month. And then in a month, if this situation does not get any better, then we'll postpone it for another week or two. And so I think that the community was just really confused about the timeline set that GDOE set to return to the schools. A lot of the parents wanted to go back to school, and we had a small percentage that was hesitant to send their children back to school. Is there anything that you have in place? I know you, in your testimony, you did put the just in case mitigations, but should we start to see a spike again, is there anything that you have in place where the timelines are more accurate and then the parents are able to adjust their lives to meet the change of the school scheduling?
Yeah, well, this is I would say an incredible balancing act that we try to achieve. But let me just state for the record that early on when we started out reopening, our schools, that of course was based on several stakeholder meetings where we were able to discuss, inform, and get input going in. So when we were fully committed to, getting our schools back open for in-person instruction, and a lot of the stress and anxiety of those first 2 weeks were really focused on ensuring that the protocols that we had in place were going to work. And, based on that 2.5 weeks of experience, and based on public health being there, I mean, we invited them. We said, we don't want you to go and make decisions about whether schools are safe or not. Come with us. And again, I really thank Director San Augustine for coming himself and not just sending staff, but we had representative of the CDC there. We had, the director, the deputy, Terry Uggan. We had, Chima Mbakum and others who, the contact investigation unit as well, would come out and they would walk through the schools, not just for 10 minutes, but you would see them in class. You would see them when they were able to go in their passing time. We saw them on lunch. I think the only thing we didn't see that the schools encouraged us to look out for was the bus pickup, and at the end of the day. But that certainly was on the radar for later. So I think public health, because we wanted to make sure that the conditions within the school facilities were safe to continue to open. What we didn't have control over was the community risk and what was happening outside of the schools. So again, the governor has to make those tough decisions. And she made that decision on a Friday. And, I did ask to please consider allowing us to go into cohorts so that we could continue to go face to face. But their advice was to put everything on pause and see what happens, to the trends in cases. So I'm not trying to second guess that, but again, from a Friday to a Monday, and we've re-emphasized this with them, anything you do, we need some lead time, because it's not just a shifting teachers and 28,000 students from one mode to another. We also need to be able to talk to our parents and our stakeholders to let them know what's happening, what we're going to do, why it's happening, and then enable them to adjust their lives without trying to minimize the disruption. And as you know, that can't be done from a Friday to a Monday. So when we came back, we did say, please give us the flexibility to reopen on our own terms so that we could then, communicate that and make our plans accordingly and do it in a stable, organized fashion. The challenge, of course, on that end was that you recognize there are some who want to, let's start tomorrow. And then there are some who say, let's wait, 3 weeks because it's so high. And even on our board, I know Ms. Gutierrez can attest, we have a difference of opinion about how fast and how slow to move. So we essentially, based on the input, took a path where it gave us some time to implement. It took us a week. That allowed us to communicate with parents, let them know what was happening, and then adjust their schedules. So going forward, it's not very easy for us to predict and say that it's going to be 2 weeks, 3 weeks, a month. What I do hope we can do is to do two things. One, tomorrow we want to release an updated dashboard and to continue that. We started with a dashboard last year, but we've had to adjust that to start accounting for school-based cases and so forth that we need to report. So what we are going to be doing going forward is utilizing our own independent dashboard based on CDC's assessment framework, and based on the usual way we approach these types of decisions. Our assurance to the families is that as we make decisions, we are going to, of course, provide enough lead time to communicate and make that transition. So they should never expect that you're going to get a call Friday and Monday, you're going to have to make those adjustments. Now, I know it's not going to please everybody, but with an organization this big, what's worked for us is to be able to keep our community calm by letting them know what that process involves and giving everybody a time to react and again make those changes, whether it's childcare, transportation, work changes, make those changes with enough time to adjust and not throw everybody's stress levels into the stratosphere. So I hope I have answered in that way, but again, a lot of communication is also important, and that's something that we're going to have to maintain with our parents.
Okay, thank you very much, Mr. Superintendent. I know that the one of the members of the board, Mrs. Gutierrez, did have something to say earlier, and I think she has some of the student representatives to speak on this issue. And if there's anyone else that would like to speak, can you just please put it in our chat box so that we can call on you next? Mrs. Gutierrez?
Thank you, Senator. I just want to let you know that, as a chair of the health and safety of the school on the board, I have been really working, a lot of work has been put in from the start of the first shutdown. And it never stopped, it continues. Of course, it's hard to satisfy everybody, but the most important thing is that to give the department, the superintendent and his management team that opportunity to work on, because, this is something new. This is not something that everybody was expecting. And then we're also obligated to follow the respect and follow the executive order of the governor. And that's where we are. So up to now, I've been as a board member and I'm chair of the committee, I'm very satisfied with the hard work that the DOE management team, the principals that are involved, there are teachers also that are involved. We have students. So for me, I think DOE has done everything to make sure that our schools are safe. As you know, of course, some of our schools are not new, and there's still a lot of work that have to be done in repairing, but the school administrators have been able to keep the school going, and learning could never stop. We have never stopped the learning. That's why I think when they put out this SNAP, EBT, whatever, that DOE students receive a lot because they never stop learning. They continue to go on and learning, and everybody was involved. But that's what I can say, Senator, is I read the testimony of the superintendent, and as a board member and a committee member, a chair, I support everything that they have been doing. So as for the students, I'll leave that to you if you want to ask them any question of how things at their own school, because a lot of them are representing their individual high school. So it's up to you, but I think they're here to listen. This is their first experience to be involved with the legislature. I wanted to give them that opportunity, but senators, if you want to ask them regarding the mode of learning, or because some of them are back to face-to-face, some of them are online, and hearing it from them, I think will tell you that DOE is doing a good job. Thank you.
Thank you, Mrs. Gutierrez. Okay, I don't have any questions, at least this time, for our students, but thank you for joining us today. And I'm sure some of my colleagues, some of the senators may have questions for you. So just hang tight, okay? We do have a request to speak, Mr. Alejandro Gay.
Excuse me, I also asked.
Excuse me?
I also asked Erica Cruz, Deputy Superintendent, before Alejandro Gay.
On COVID.
Yes, just your statement about the transitioning. I wanted to address that only because I'm the myself, as well as Joe Sanchez, the two deputies. We're the ones that oversee the operations and the implementation of our pandemic plan with the Department of Education. I'm glad that Mrs. Gutierrez is here, because even prior to the beginning of the school year. She wanted to ensure that we had plan A, plan B, plan C, and therefore we had Sinkasu. In fact, when she was in California, I had to call her and find out to make sure that I pronounced it correctly, because my native tongue is not English. So I'm Japanese, Chamorro. So I had to make sure that I had to call her so that she doesn't get mad at me. But as far as planning for the school year, I've been on this project with the COVID-19 since March of 2020, when the governor shut down our schools on March 16th, 2020. And we've been planning from the bottom up, developing a pandemic plan, developing a mitigation plan, developing or determining what we need to purchase for our schools as well as our central office, and determining burn rate, just everything. I mean, the reality is there is no playbook on how to handle a pandemic. I always say that we always read about pandemics in history, but never have we ever believed that we would be in a pandemic. And this is a situation that we're in. As far as shifting this, and I'll talk just about this current school year, we started off with 85% of our students coming back to school on face-to-face learning, and we were all prepared for that. And then there was a shift. We were anticipating that it would be a gradual shift, and the second shift would be cohort. Unfortunately, it went to remote model of learning. And with the remote model of learning, we got to understand that we have, 26,000 students, 3,000 teachers, and 41 schools that we have to deal with. So the shift is not an easy shift. The Department of Education is a very large shift. And it's not a matter of on Friday we're going to go remote learning, make sure Monday we'll be ready to go. We want to ensure that our teachers are prepared to teach the online model of learning. This is something new to many of our teachers, as well as getting our parents ready to go into remote model of learning. We have many parents who aren't able to afford laptops, MiFis and whatnot. And so we wanted to provide that opportunity. School administrators also provided training to our parents on the use of a laptop. We provided training and we upfronted our professional development to address training on teaching the remote model of learning. So we just don't want to throw our families, our administrators, our teachers, our students to the wolf and say, okay, Monday we're going to open and it's going to be online model of learning. That was never the intent. What is also important is that we've always been transparent. We've had multiple forums to include parents, teachers, counselors, administrators, families of special needs. And so we've been very transparent with our families. We ensure that they know what's going on. And so I wanted to add that because, as far as the implementation or the opening of schools is a big responsibility, and that responsibility really falls on Mr. Sanchez and myself and the team, our operations group that meets three times a week. Sometimes 3-4 hours, and we also meet on Saturdays and Sundays just to plan. And so I just wanted to put that input. Thank you for the opportunity.
Thank you, Mrs. Cruz. Is there anyone else that would like to speak before I call on the senators if they have any questions or comments? Okay, I'll start with the, okay, we have Senator Blas that joined us earlier. Thank you, Senator, for being here. We'll start with you.
Well, thank you very much, Madam Chair, and thank you to all that are here. Superintendent, thank you very much for your briefing on that. He and I had a conversation a couple of days ago, and I think that was a lot of the information that you provided then was information that's here. I'm pleased to hear that as big as a ship as you call it, Mrs. Cruz, as it is, I for one can attest to the number of planning meetings that you guys have had, and having to cook my own lunch on Saturdays and Sundays because you got my wife in meetings too. So I very much appreciate that. Mr. Superintendent, I guess just one question with regards to your testing or the mandatory vaccination protocols that are supposed to have been in place since the 24th of September. Have you started those protocols in the schools for the teachers?
With regard to the employees, no, we haven't.
Okay.
So again, we do have the guidance that DOA provided, and we have been in touch with them, but there are several things that need to happen before we implement the required testing. So right now, the government has designated testing sites for GovOM employees, and those sites, certain agencies have been assigned to those sites. However, DOE is not assigned to any site at the moment. I believe the shared intent is to be able to do it at the school level. However, we need that explicit authorization, but the standing order for our nurses to be able to properly administer and supervise that activity. And then, of course, making sure we have enough test kits to move forward. Again, we have about 250 tests per week. We want to make sure we have enough tests on hand to be able to ensure that we don't start and stop this, this process. That once we start, we can ensure that it's a smooth process. So we're working with public health on those pending matters.
And then I guess my last question is with regard to that whole conversation about the random testing for the students, even at 10%. What's your current student population now?
Well, it's going to be in the 26,000 range. We don't have the official out yet, but it is in the between 26 and 27 is what our preliminary numbers look like. So you're talking 2,600, students, depending on what the frequency is. So yes, absolutely, it's a big number, and I think that's something that we have to continue to work on to understand how that's supposed to work. And then, as you and I discussed, I think parents have been concerned because they heard this over a weekend and without much explanation, but they were jumping on our, to make sure that they were communicating with us about, some kind of mandate on students. And it really isn't, supposed to be a student mandate. So we need time to, make sure we have a plan that works for us, and of course, be able to explain it. Because again, as a parent myself, I wouldn't want, to have something like that implemented without knowing, what our rights are and what the benefits and risks are of such a process. So we do plan to make sure that once we have a design of a plan that we believe will work,
well, okay,
we want to share that.
Okay. Well, thank you very much. I'll keep in contact with your communication, see how we can help. Thank you very much, Madam Chair.
Thank you, Senator Blas. Senator Ada, thank you for joining us. Do you have any questions? Primarily, we are on the first topic, and that is on the COVID reopening of schools. So if you have any questions on that.
No, I just wanted to comment on the progress that DOE has made. And I visited the schools just before the summertime, earlier in the year, and hearing the plans and the progress that has been going forward. I'm very pleased to hear that what they've been doing is stepping up and actually coming out and improving what was done previously. So, hats off to DOE and to their team, Superintendent. You guys just continue to do what you do. It is challenging times, and I know that plans don't come perfect. but we can try to perfect them for, moving forward. And, all we can do here is to try and support and to help the education department and the faculty, staff, and teachers, everyone that, that we can, whatever that we can do to try and help. We're here. We don't want to get in the way and be a impediment to what you guys have done. Of course, there's going to be issues that are going to be asked and need to be addressed, but I'm sure that you'll be able to conquer those. And, like I said, if there's anything that we may assist, please don't hesitate to call on us. Thank you, Madam Chair. That's the only thing I have on the COVID issue.
Thank you, Senator Blas.
Thank you, Senator.
I'll now offer the opportunity to speak to Senator Mary Camacho Torres. Senator Torres, do you have anything that you have any questions or anything you'd like to speak on?
Yes, I'd like to ask Mr. Fernandez. I heard you comment about when you're talking about the back to school and the challenges with the instruction. You had mentioned that there may be a need to revisit the learning hours requirement. What did you have in mind at this point, being that we just started the school year?
So we currently have, a mandate for the number of instructional hours that we have to provide during the school year, and our calendar is built around that. So what we are trying to avoid is disruptions in our school calendar as we planned. So when we went into the first shutdown, instead of losing 5 days of instruction, we just really we moved our professional development days up front so that we could preserve those instructional days later in the calendar. However, moving to a cohort, even though it's a situation that we don't want to be in there for the long term, what essentially happens is you have students who are going to go 2 times or 3 times a week, and that means they're losing that 2 days or that third day because during the time that they are not in class, they are doing work, they are supposed to do homework and other things at home, but it isn't 5 days of instructional time that is otherwise would be the normal school expectation. So I guess just in order to be compliant with the mandate, we wanted to look at that, get some flexibility around that mandate, and also around service learning requirements to graduate, which I know that the legislature did a couple of years ago, but it didn't address all of the existing students now. So we wanted to revisit that as well.
Okay, please work with the committee, because what I don't want also is for the kids, particularly the seniors, to be in jeopardy of not applying for colleges timely and getting all of the credits that they need. So, I appreciate the clarification, and I just want to offer that we'd be very willing to address that right away, before we get too far into the school year. That's all I have. All right.
Okay, we will do.
Suez Masi.
Suez Masi, Senator Torres. Senator Perez, do you have any questions?
Yes, thank you, Madam Chair, and thank you to all that are here tonight. I do have a couple of questions for Superintendent Fernandez, and so I'm still getting reports about ventilation issues, air conditioning issues, and specifically since this disease is transmitted through the air. I understand that you are in the process of, or you've actually fixed the procurement of the air purifiers, which is good. But I think that what can be done, especially for those classrooms that don't have outside access to air, opening up their doors to or windows to the outdoors. Has there been any type of mitigation for that, for those classrooms that don't have access to good ventilation?
So I would start by saying there has been tremendous progress in addressing those issues since the summer. However, we're dealing with a backlog of, so I think back in March is our last contract. We ran out of funding basically toward the end of last school year, And so what we were working on during the summer was to move funding from the federal funds into that existing locally funded contract. So we're in the last year of that 5-year contract with the vendor, and we were successful, Mr. Ike Santos and the federal programs, in doing what we needed to do to be able to provide another $1.6 million to begin the immediate replacements and maintenance on any air conditioners throughout the district that needed repair or replacement. So we have been keeping tabs on the progress that the vendors have made. However, that doesn't mean that every air conditioner is addressed. There are some that are either recently gone down or are on the schedule but still need to be addressed. So what we try to do is let the administrators know when the vendor is coming, what rooms they'll be addressing, so that our administrators can try to work with the teachers for alternate solutions on at the school site if there's another available classroom that'll work while we're waiting for the vendor to come around. But that was really the challenge and the holdup late last school year. The department has undergone a number of cuts over the last several years as a result of the federal funding, tax cuts and so forth. So it's really hurt us on the operations side. But with the federal funds that have come and become available, we set aside 1.6 for this contract, and I believe we have about 14 million in our ESF2 funds to go towards ventilation. Once this contract is coming towards an end, we plan to re-solicit for that continued support on the air conditioning ventilation side, in addition to the HEPA filters that we're hoping to get as well.
Okay, thank you. So would every classroom be expected to have air purifiers?
Yes, that's the plan.
Okay, great. The other things like sneeze guards. You'd mentioned earlier that you're building them or putting them up in common room areas such as cafeterias. Does Department of Education, do they have plans to put them in every desk, student's desk as well?
No, we don't. We sneeze guards, I think, have been provided to teachers as well as to students and available to students who have particular difficulties, being able to wear masks, throughout the school day. And so that's a limited amount. We decided not to, go with sneeze guards on every desk because of some of the experiences we've heard over at Dodea, because of the fact that, in any of the guidance that we receive from healthcare agencies and so forth, the sneeze guards are not necessarily shown to protect, when you have a mask on versus, unmasked. So it wasn't a particular benefit, but there definitely was a need to clean and, also sanitize those surfaces as well. So when we came down to making the decision, because the cafeteria do have students who have to remove their mask, and because not every cafeteria has been able to address that, that situation. What I mean by that is some cafeterias, some schools that have enough desks where they're able to just put student desks in the cafeteria, which really seems like a pretty successful way of operating lunch without exposing kids to the risk of talking and facing each other with their masks off. But those who still have the cafeteria tables or plan to use those tables, we did think that would be an advisable measure, even if it requires the extra sanitizing, because that's the place in school where the masks come off, and that it creates a much higher risk. I think most of the science we've seen has basically prioritized the use of the mask as an effective protective measure. But when you go to the cafeteria, we have to allow them to remove those masks, which is why we took the extra measure of putting those dividers in.
Thank you.
But not for every student desk. So,
how about for special needs students, specific classrooms? Do they have additional layers?
Yeah, I'm gonna see if my team members on. Doris, are you available here? I can't see you.
If I may, in response to that specific question regarding special education students, as the superintendent pointed out, we actually identified, or the schools identified, which special needs students or students with disabilities that could not wear the mask for extended periods of time. So those individual students, as well as those with medical conditions that would also find it challenging to wear the mask all day, those students do have sneeze guards, and they have it for every classroom that they transition to. So we did make those arrangements. We also did, we gave each school an additional cushion of shields in the event that students transferred or new students came in that did have those issues. So we, of course, still want to keep all children safe. And we did actually have that in place.
Okay, great. Thank you. So the other thing I have is the CDC guidelines for testing. And it says that students, the recommendation is for students to be tested weekly for high risk areas. And then it goes on to teachers and staff, also weekly for unvaccinated. And then for high risk sports and activities. So if there's substantial transmission, there should be also screening weekly for those that are not fully vaccinated, and that in high transmission areas that they should be actually canceled. So I know you mentioned earlier that you were going to do random testing. And this screening is supposed to help with identify any kind of transmission within the school setting. Being that we don't, I think you mentioned earlier too that you're focusing a lot on the teachers, but you know, as far as the students go, to ensure that there is no transmission within the school, what can you offer, or what is your take on the CDC guidelines and how
Right.
it's implemented?
No, thank you, Senator. Yeah, no, I'm glad you're referring to that. First of all, when I mentioned that we're focusing on the employee testing, is mostly because that's, you know, that is part of the executive order mandating requirements for vaccinated employees, you know, or otherwise weekly testing. So we know who those employees are, and we can plan accordingly based on the supply of tests that we have. So that was our first area of focus. With regard to the student testing, that is an area where we still want further clarification and guidance. And as you said, you know, it's kind of taking the time to read through, you know, the CDC guidelines, FDA, you know, guidelines and other things out there to figure out just how to do this. So, you know, I think public health is really guiding this. And my understanding is I think the random 10% testing is included as a part of a grant from CDC that they are getting to supply the rapid test kits. So that's one thing we have to straighten out, because like I mentioned to them, my understanding of the Abbott Binax Now tests is that it is more of a frequent serial testing approach versus a less frequent random testing approach. So that's a type of, you know, discussion that we have to have. Now, we understand that Abbott Binax Now is also in short supply. I believe they're no longer producing, you know, the rapid tests. So my understanding is public health will be shifting to another type of test. I believe it's called Q Health, which is a salival rapid test. So, you know, we're going to have to, you know, incorporate training on that, as well as understand what the recommended screening testing approach is for that test. So yeah, I'm not fully, you know, comfortable with, you know, what the approach ought to be versus, you know, like you said, the employee vaccination, you know, that's in line with CDC guidance. It's part of the mandate that we have, you know. So with regard to students, you know, we're going to take some more time to do our research and work with public health to make sure we're all on the same page. So I think the public health guidance basically set a 90-day target for 10%, you know, random student testing. Knowing that we have to ask, you know, get consent, we have to, you know, figure out what the impact of that is on the randomized nature of the screening and so forth. So, you know, there's a lot of questions that we want to, you know, understand and be comfortable with before we, you know, put that in a plan and prepare to execute. So like you're doing, I'm reading the guidance and reading the details to make sure I understand.
Okay, thank you. And then as far as monitoring, so yeah, there were some reports prior to the interruption of face-to-face learning that there was a lack of compliance. And what are your plans moving forward to ensure compliance, that people are keeping their distance, wearing their masks? How can we ensure that is being followed?
So again, that's going to be a continued process. And I think right now with the cohorts, it's a little easier to do, but the biggest issue had to do with physical distancing, out in the common areas, and not everybody getting together, but there's an ebb and flow, as especially with the older kids. When they come out, they might be distancing for a little bit, then they come together to look at each other's phones, and you're going to constantly need to be supervising that in order to maintain the distance. I think the issue is, it's not just distancing that creates risk. I mean, there's a multiple, the multiple layers of protection that we want to see at schools. They all work together. So, a lot of the physical distancing, studies that you see also, always include factors like what happens when you're not wearing a mask versus wearing a mask. So we're very glad to see that students are wearing masks, and there doesn't seem to be a lot of issues with that. Now, the physical distancing is a challenge. It means that the students and the staff have to continue to work on that, and that's probably going to be a continued effort. It's challenging at the school sites. I mean, the schools have had to do things like continue to reorganize their lunch periods, having more than one. Now it's 2, now it's 5, just to minimize the number of kids who are out and about at one time. And so there will be some impact on scheduling. If we can, once we get those canopies in place, we hope to provide opportunities for additional distancing outdoors. Again, it's just something that we have to continue to try to work on in those areas while students are out of the classroom. Inside the classroom, I think for the most part, as we've gone in, we have seen, relatively good compliance. I think the only things that public health mentioned was that a couple of things. One was to ensure that there was a very clear entry and exiting, an orderly exiting and entry into the classroom. So one thing they wanted to see was that students lined up or sat in their seats in a certain order, and then when they exited, they did it by rows through another exit, so that they're not constantly passing each other. So we're going to work to make sure that is something that goes every school complies with. In addition, as part of the contact tracing experience, we have worked to ensure that every class has a seating arrangement, and that seating arrangement becomes critical then to contact tracing. So it was tough in the first couple of weeks because, as in secondary, kids change classes within those, may switch classes in those first couple of weeks. But I think the guidance that we got from public health is that once we identify a positive case, having those seating arrangements ready to go helps to identify those students who would be potential contacts, and and then it makes it easier to identify them and take the necessary actions. So as far as compliance is, again, just more reemphasis. When we get reports, we address it directly with the administrator. We got reports, for instance, of maybe a staff member took his mask off, on campus to breathe temporarily, and was taking a picture. Someone took a picture and sent it to the administrator. So, we deal with that and just remind all of our staff and our employees that it might, you might want that relief. It might seem like you're safe to do so and nobody's around you, but even just the perception, of non-compliance just, really riles people up and gets concerns, from in the community. So we'll do our best to address that. I do want to say that in the early couple of days, we saw some concerns about physical distancing and social distancing, and we understood, some of those concerns. However, we did see schools make some adjustments quickly once they observed how things operated and how the kids were going to behave when they came in under these new protocols, to be able to address that. So we hopefully won't see as many of those issues going forward once we return from the cohorts.
Great, thank
Sorry,
you.
if I can add, I'm sorry, if I can add, Our schools have submitted a mitigation plan, which was due October 1st. However, we did submit it way before that. And public health has been coming to our schools to do conducting their visits to ensure that we are following the protocols. And from what the reports that I've been getting from our school administrators, we've been doing very well as far as following protocols. I think it's also important that parents remind their students about the new normal, about physical distancing, about not sharing food and whatnot. There's just so much that our staff can do as far as policing these requirements that are put upon us by the executive order as well as the public health guidance. And so we do have a mitigation plan. Our faculty, our staff, and our school administrators work very hard to implement that. If there is a complaint that is lodged to the Department of Education, we work directly with the school administrator to correct those issues. However, in the last 2 weeks, public health has been coming around to the schools to ensure that the mitigation plans that were submitted we are actually following. Thank you, Senator.
That's great to hear. Just another question, last question. Thank you, Madam Chair. So is there regular reports of positive cases being released?
So we are, when we returned, we did not. So we are resuming that this week. I think part there for a couple of reasons. Number one was, of course, as we were returning to cohorts, there were a lot of, we received a lot of reports coming in actually since August 30th. And we were not reporting them after a certain amount of time because they were all coming from home. But we were still getting the reports, even though, for the past, 12 days, the students have been at home. And so the whole point of our reporting is to determine or to share when a positive student has been on campus, just so people can be aware. And over the last week, as we received reports of students, it was very, very confusing information because a lot of the students, there wasn't any contact screening needed. They were reporting, but they hadn't been on campus. And so we just gave it a week to sort itself out because we know a lot of cases were coming from contact tracing out in the community. So this week we plan to resume that reporting. I think the change that's happening this week is that we will be reporting them directly ourselves now rather than through the JIC. I think the governor's office in discussing this with us let us know that agencies are reporting themselves similar to the port. So we've been asked to go ahead and do that reporting ourselves, and so we are going to have to organize our report so we can put it out on a daily basis. So that should be coming out this week, and then we'll resume it on a daily basis so that the community is aware. In addition to that, we will be putting a weekly dashboard out to summarize this data as well for the community, which will include the risk, some of the risk assessment issues, as well as other information that we hope the public will find useful. And again, that'll come out midweek this week, and then continue going forward.
Okay, thank you, Jim. Maybe just one more question. Sick leave. So should an employee use up their sick leave time? What can they use in case they are sick?
That's an ongoing question that we have to address. Right now, the policy is to use your sick leave, but again, we understand the issue with those who either are running short on sick leave or are part-time employees as well, where it's become an issue where if they don't report, they don't get sick leave. They just don't report to work, they lose pay. So it's something that our HR division is looking at. So we can try to address, but that has come to our attention to try to handle.
So they can also use advanced sick leave. So they could, there's 13 days that they can request for advanced sick leave, and then also leave sharing if they have someone with the department, with a government agency that they can request to request for shared sick leave.
Yeah, but I think it's still an issue from a policy standpoint. So I think employees have informed us they're taking sick leave because they've been identified as a potential contact. They stay home, they're negative, they report back to work. Why did they use their sick leave? So it's something that I know that it gets government wide, but it has been brought to our attention so that we can figure out if that's the right approach, going forward.
Yeah, absolutely. Because the last thing we want to do is they run out of sick leave and they're sick, and they then spread the virus.
Yeah, there's that, and then there's our part-time employees. We want them to, if they're sick, to stay home. And what you're going to find is if they're not able to earn, their pay for the day because they're trying to be cautious, they may be tempted to come to school and try to hide their symptoms because we're creating an incentive for them not to report their symptoms. So it's a tough one that it's come to our attention, and I know our HR division is working with DOE to see if there's any flexibility or further guidance on that, but it is impacting our employees, and that's something that we'll try to address.
Okay. All right. Thank you so much, Superintendent and staff. Mr. Masi, Madam Chair.
Thank you, Senator.
Okay. Senator Shelton, Acting Vice Speaker, do you have any questions or concerns?
Thank you very much, Madam Chair, and thank you to everyone on the call for the updates this evening. I really appreciate all of the information and especially all of the work that you are doing to plan, prepare, and adapt to all of these mandates that we have, and to keep our children in the school safe while still providing them with a quality education with all of the different challenges that we have in front of us. Thank you very much for all that you're doing. I was able to also visit some of the schools on the first day of school, and I was very impressed by everything that I saw, the measures that were in place to keep our children safe. And I saw how excited the children were to return to school, the joy in their face, excitement, a little nervousness maybe, but it was really nice to see after such a long time being away from friends and teachers to have that come back. And so I know how important that is for our children to be able to thrive and to really be happy in their lives and develop emotionally and physically with the support of the Department of Education. So thank you very much for that. Mr. Superintendent, if I can just ask some clarifying questions about the tests for our employees who are unvaccinated. You did mention that you received test kits, and are these test kits that we're getting directly from public health, or are you sourcing these on your own?
Right now, we've been assured from public health that they'll be able to supply us with the test kits. So we inquired and we were told that we can rely on their test kits. So we have not sourced on our own at this point.
Okay, and so when there is a transition to the new types of tests, then they will provide the training for your team to do that?
Yes, we're definitely going to need new training. So the Abbott Binax now is, what do you call it? It's the nose swab. And then of course, what we understand, the Q Health is a salival swab. So we're definitely going to have to make sure we don't mix the two up. So everybody needs to know what they need to do. So we appreciate that support. And of course, our school nurses, we have Nurse Kim Adusma here who's acting for Julieta Kaneni, and then our whole team of nurses who really have taken the lead in this effort. So we will need to constantly make sure that we're trained and up to speed with regard to the tests.
Okay, and right now, did you say that this testing is only for employees, or are we already testing students?
Right now, we're not doing any random or testing of students, to screen them. Even though we're looking at it from a planning perspective to try to put that plan together. We do know there is a requirement for employees to be weekly tested, and so I mentioned there's some 3 pending items that we're waiting for to initiate that. And then the other mandate that's out there actually is for interscholastic sports. So all coaches and athletes who are 16 and over actually are mandated to be fully vaccinated or to submit to weekly testing. And so we're still in the process of gathering that information. Again, our first step will probably be with the employees, because we have I think we're able to manage that before we expand more broadly to do screening for students.
Okay, thank you very much. Thank you, Madam Chair, for the time.
And Senator, if I could just want to mention, like you said, the joy that students feel coming back to school, we all felt that. And on the flip side, when the school shut down, my two children wouldn't talk to me. So we know there is a desire for kids to be back in school. And I know it firsthand. When they said, we're going to go online again, they said, look, we want to be back in school, even cohorts. So we do want to see our kids have that joy and comfort and safety being back in their school facilities, and we want to work towards that.
Absolutely. Thank you very much for all the work that you're doing to make it happen.
Thanks, Senator.
Yes.
Senator, can I just share something? During my off-island time, I was able to go around the schools in LA, and I have seen that our protocol here are much more strict than the protocol in those school areas. The students are not even social distancing. Yes, they're wearing masks, but no social distancing. Even going out to eat dinner with my granddaughter and go down to Disneyland, nobody's social distancing there. There's no limit in the restaurant other than they wear masks. Some of them don't even wear masks. So I was very happy that here we're very on Guam. We really go with what is the protocol. And also in one of the high school in San Francisco, but just before I came home, one of my granddaughter goes to one of the high school in San Francisco called Mount Diablo High School, and the students there don't social distance. There's no protocol of when they enter the school campus that they get temperature checked other than just wearing their mask. So I think for us here at DOE, we are really, the team are really working and ensuring the safety of the kids that, of course, social distancing is really hard. And it's really hard for the school staff, especially if there's shortage, because kids are kids. And of course, they're going to run around. They want to hug their friends. But I would just want to commend the Department of Education employees, from the principal down, even the teachers and the staff, because they are really doing their best. I've seen it. I was really shocked that even at the airport, there's no social distancing when you're getting your luggage or you're checking in or you're going to the TSA. There was no social distancing. Here on Guam, we have that social distancing. So I just want to, share what I saw, and I was really surprised. So thank you for that.
Yes, thank you very much, Mrs. G. Absolutely. I'm very thankful for our protocols that we have here, and that our people are so willing to follow them to keep each other safe, that we're doing our part. And I know I heard from many teachers at the beginning of the school year who were becoming exhausted after reminding the students to separate, to stay away from each other. And even when they were eating, they had to remind them, please don't share your drink, please don't share your food, little things that we're so used to, but we have to adapt to those changes now. And so I know it takes everybody to keep reminding each other, even us adults, we have to remind each other not to hug and kiss like we're used to, but it's what we have to do now. So thank you very much.
Okay, thank you very much, Acting Vice Speaker. We're going to move on to the next topic on the agenda, and that is the Stakeholder Concerns on the Suicide Risk Assessment of Students letter that was sent out on September 2nd, 2021. And Mr. Superintendent, I want to thank you for responding in your letter, and also continuing your dialogue with me on some of these concerns. But I just wanted to point out that in the first paragraph, it says that that concerns raised in this letter are very similar to concerns previously raised in a grievance filed by 25 of GDOE's 41 school guidance counselors earlier this summer. And so the concern is first, the issues posted in the letter are significantly different from the grievance, because what we want to address is the SOP, right? We want to address some of the challenges that we see in the SOP and in the manner that and perhaps the format that was applied for the SOP, which makes it a little bit difficult. And the SOP was done after the grievance. And then also we are referring to Chapter 17 in one of our items, but Chapter 17 came out in August. And so I don't know if the grievance included Chapter 17, but I know that the Chapter 17 came out after the grievance as well. So these are the questions that we want to, I understand that, you know, there's a process that you need to do at the adjudication, and I respect that as, you know, as you being the superintendent of GDOE, absolutely, I respect that. It's just that we want to address some of the format applications and how the SOP is written, and also providing the necessary resources for our school counselors. And so we do have some people that would like to speak on it. Would you like to speak first, or would you like to hear some others' testimony? Up to you. Perhaps maybe we could hear them and then you can address what their concerns that they have.
Well, if I could open up, and then I'm happy to listen
Sure.
as well.
Okay,
First of all, if I could, I'd like to read the letter. No, I'm just joking. I've sent this out. I've sent this out widely. You know, let me just, I'll step back, and I just want to acknowledge that like I said, when I said these concerns are previously raised and agreed, I'm not saying that they are an exact mirror of each other, but they all do reflect certain issues and dynamics of concern that have been evidenced by the grievance that was filed. And of course, as I mentioned, we did receive recommendations and review by a grievance committee, which I thought was a very balanced committee made of 2 school administrators, a classroom teacher, and a school guidance counselor. And I found that their recommendations were reasonable and sound. And I'd like to, you know, take the opportunity to have those be, you know, a roadmap for how we kind of move through this issue. Now, with regard to the specific responses and questions and responses, you have them here. These were, you know, as one of the counselors asked earlier today, you know, who helped put these responses together, and that happened for the Student Support Services Division, as well as our district psychologist, and Nadine Cepeda, our district school psychologist, is online as well, and of course did much of the you know, the research and guidance in responding to the concerns. So I responded in that way, just to provide, you know, that response from to those specific questions. And as you can see later on toward the end of the letter, I also went through so that you also had an understanding of the types of issues also raised and recommendations offered out of the grievance process this summer. And as you can see, there were several recommendations, and my review of them, you know, does not, you know, I feel like these are reasonable and sound, and again, present the roadmap for how we try to address the concerns that school counselors have now and going forward. Now, I did hear from some of our counselors today. As I mentioned, somebody wanted to know, you know, who put these responses together, because they disagreed with them, and I informed them that where this came from. Another wanted further guidance on what appeared to be conflicting language between 2 different chapters, and wondered how to proceed. And so I've asked her for additional specific examples so that we can try to find a way to address that. And then, of course, there was an issue brought up about the timing of these recommendations and the issuance of the SOP that came out prior to the school year. And my response to that is, you know, leading into the school year, we always need to have an updated SOP in place, and that was the intent, to put something in place to guide, you know, people for the school year. However, you know, there is a need to clarify or amend or modify that going forward, there should always be a process that addresses that. So I want to just address that generally, and also to let this is not something that's going to be addressed overnight. As you can see, a lot of it has to do with communication, collaboration, and we're going to need to look more closely at how that takes place. But again, I don't think that the recommendations that are here in this letter are unreasonable, and I think again could provide a roadmap to how we address any disputes or issues going forward. So, but I do. Let me finish by saying, I hope that we can come to that agreement and we can find a way. Deputy Superintendent Erica Cruz oversees this area of the department amongst many other things. Chris Anderson, the student support, and Nadine Cepeda are also key players in trying to provide guidance as well. So from this, I would want to take an opportunity to figure out how we can put together a resolution. A process to move towards resolution that takes us through the school year, because this is not something that I think is going to be cured overnight. We can address specific issues, areas of clarification, but again, a lot of it also seems to deal with input, people feeling that they're not being heard or feeling that they don't have a role. And I don't know that that is the case or not, but it's something that we definitely want to see happen in the school district. I do want to make it clear that I do not condone asking any employee to act in contrary to the law, contrary to department policy or any other governing policy, or outside their scope of practice. So if that is a concern and there's any fuzziness or gray area around that, I want all employees to know that. And I think our team at the central office understands that as well. So I just want to make sure, because if that's an issue, that's where we don't want to cross the line. And again, if people feel that, we certainly want to make sure that those issues are addressed. But social emotional well-being is a real key issue that we have to address, for our students in emerging from this pandemic. It's going to take our district school psychologists to be a part of that. It's going to take our school counselors to play a part. And, we're all going to need to be on the same page, the same team, in order to move that forward. So that's my commitment, Senator. You have the letter and responses. And if our counselors disagree and want further guidance or clarification, or figure out ways to increase collaboration, that's something that I'm going to task the deputy and her team to focus on and to ensure we address based on the letter that I put forth to you today or yesterday. So I'll go ahead and won't read the details, but I'll go ahead and take questions or listen to the other comments.
Okay, yeah, thank you, Mr. Superintendent. And I appreciate that. I appreciate the effort that you will continue to make to collaborate with the counselors. There are some issues that we can address in updating the statute, right? And so that's one of the areas that are up for debate, right? The 45 days. And so I'd like to work with GDOE in how we can fix the interpretation of this statute. Also, I do want to acknowledge that for several years, in the public law, you've continually you've updated the SOP, and you did the what is that? Hold on, sorry, just give me a moment. It's the informed consent letter, and so you finally GDOE finally inputted the informed consent letter. But it is confusing, because when you read it down, it's almost like the parent is the student. The pronouns are mixed up in the informed consent letter. And then usually you'd want to fix the, I guess the grammar, right? You want it to be simple for the parent to understand. There's a lot of medical terminology used in there. There's, some words that those that have English as a second language or a third language would not be able to actually complete and fully understand the gravity of the letter. And then we also have the concerns about continued training. And so there was I guess there was inconsistencies with what we were hearing from our stakeholders, and then also the training that is being given. And so some of the concerns were the suicide risk assessment training. They said that they were given during professional development, but not everyone was able to avail to that. Additional training the counselors have to specifically ask for. They also sometimes have to pay out of pocket or take admin leave to attend continuing education training to keep their certification. And so these are just some of the concerns that they have. But most importantly, I think they feel, not I think, but I met with some of the counselors, about 40 counselors last night. And their concern is the conflict with the SOP, and because things are not clear, they even recommended if they could pause the SOP until they could come to the table and discuss exactly every item in the SOP that is inconsistent with how they should be, their job duties as a school counselor. And so just one of the things one of my concerns is the suicide, right? Because this is very important. And I want to make sure that these are our children, and I want to make sure that they are receiving the support that they need, the level of care, and whatever the community can offer them to let them know that they are important and they are wanted and they are not alone, that they don't have to be in despair so that they don't contemplate suicide. And we have Miss Marie Holleran, who took a look at the SOP, and she reached out to our office and shared her concerns about the SOP. So if you don't mind, I'd like to call on Miss Holleran to just discuss the intricacies of the way she sees the SOP addressed in, sorry, it's been a long night, the way she sees the suicide intervention addressed in the SOP. Okay, so I'll just call on Ms. Holleran. Ms. Holleran, are you there?
Yes, I'm here.
Okay.
Good evening. Yes.
Can you
Okay.
turn on your camera, Ms. Holleran? Are you able to?
Which one?
Your camera? Are you able to turn on your camera?
Oh, yes, of course, of course.
Thank
Okay.
Okay, we can see you now. Thank you very much.
Okay. Yeah, my main concern is, the school counselors in the past have so many roles in the school. They sometimes become, they do clerical job, they become principals, but most of all, my main concern is about addressing the suicide. Okay. What I'm seeing is they are supposed to do an assessment on students when they come, when the students come and they are exhibiting some indicators of suicide. They are supposed to do an assessment whether they are not in imminent danger or in serious imminent danger. To me, with all the experience I have, if a child shows indication or exhibiting indications of suicide, this is always taken seriously. You do not, you don't see them from 5 to 10 sessions, then you evaluate whether they are going to be given to a resource, to the school psychologists, clinicians, and all other resources. Just imagine 5 to 10 sessions before you could refer them. I believe that if a child is showing or indicating red flags of suicide, I think that in the first session, the school counselor could evaluate, the child. And like as I said, with suicide, time is very essential. You cannot buy time and say, oh, I'll wait another 7 more sessions. I think this is so serious. Kids, from my past experience, children, when you ask them, are you okay? They will always say they're okay. But in your heart, you know that they're not. So I think that we should take this seriously and refer them to the school psychologists, refer them to other resources. And one of the things too I wanted to share with you is school counselors are not licensed mental health screeners to diagnose students using mental health screeners assessment. So that to me is DOE is playing with fire and waiting until 10 sessions or even 7 sessions or even 5 sessions. For me, 1 session is good enough to refer them, because you don't want another death in your school. So that is my main concern. And I'm very strong about this because this has been my life, 20 years I have been addressing suicide on Guam, and you cannot buy time. You have to refer them. And also, I believe that parents has to be notified if they're minors, and the principal, and also confidentiality of the situation is so important. So that is why I'm here today. I am very determined that we address suicide in the school seriously. And we should use our school psychologists, because they're the ones that should follow up these kids. And the school counselors are in charge of the whole school. And that's the reason why they need to refer to resources, because that's their role. And I also wanted to share with you that the American School Counselor Association does not consider this sound ethical practice, to refer students 5 to 10 more sessions or something. So like as I said, with suicide, you are buying time. You don't have that luxury to wait till even 3 or more sessions, because by the time you're going to refer your students, maybe the students have attempted or completed suicide. So that's my task. That's why I'm here. Thank you.
Thank you, Mrs. Holleran. And so, Mr. Superintendent, can we just talk a little bit about what Mrs. Holleran said, right? That it seems that the school counselors are now being required to do their own assessments on the child who, I don't even know how to say it, but to do their own assessment in addressing suicides. And so the issue is the SOP requires the counselors to perform this necessary function. But Ms. Holleran is saying that this is not the school counselor's expertise, nor are they trained to do this type of assessment with a child, and nor should they be able to, or nor should they be doing it several assessments after the first one, because suicides is a when someone says they want to commit suicide, you need to react right away. You don't wait till several sessions later. So is the SOP, so how are we going to address improving that process in the SOP? And so that's
First of all, if I could ask Nadine to speak up. She has had a central part in helping develop the SOP along with others, and I'd like to hear from her as well. She's done a lot of research on and experience on this as well. So, if we're going to use this opportunity to communicate these issues, I'd like to hear that response as well, and maybe we can hear if there is a disagreement or if there is room to be on the same page. Nadine? Yeah.
Thank you, sir, and Madam Chair, for this opportunity. So to clarify, they cannot diagnose. One, these assessments are screeners. They do not diagnose. School counselors are not qualified. They're not mental health professions. Secondly, in chapter 12, if you really look, we did not touch that chapter. It says the first time someone suspects or says, I want to kill themselves, one, they cannot leave the student alone. Secondly, they must do 3 things: the critical questions. Secondly, the Columbia Severity Suicide Risk Assessment, which, mind you, is a screener that's evidence-based and used in international and America. Third, they use a suicide checklist, and it rates it from moderate, high to moderate, medium, and low. Again, medical is the priority. If it is immediate or acute, they go and consult with the nurse. That it takes precedence and priority. And if I may, Senator, this is an important thing. We lose many students. And I have to say, this is why we put this in place. We are not waiting for the 10 sessions. That 10 sessions interventions are actually made to refer to the school-based behavioral health. However, if you read that chapter, they must consult with the licensed mental health. If it's immediate, bring them to Guam Behavioral Health. Senators, I have done research. I've consulted with UCLA. I've consulted with other districts. This, unfortunately, has been what we're dealing with. It's unfortunately been in our community even before COVID. Since last week, 3 counselors had consulted with me in suicides, real serious cases. I have taken one and have done home visits. As high a risk, again, I have to think about safety, was admitted to Guam Behavioral Health. So it can't just be the psychologists. School counselors are seeing them firsthand. Teachers refer. We all play a role. It is for all of us to take part in this. That's why partnerships such as Guam Behavioral Health is so critical. We work hand in hand. It does not say you cannot refer. We do. Immediate and counselors know this. Please, it says that you cannot leave the student alone. In fact, you must inform the parent. For anything you touch with the student, you must inform the parent. The parent ultimately is responsible. Research even indicates when you tell them refer to go to a mental health for assessment, they do not go for several factors. Transportation is an issue. Parents may not want to take them, issues because of stigma. I'm very passionate, and so many of us are. But when we look at it, please refer to chapter 12. We do not say you're diagnosing, they're not qualified. They don't have the training, and if we're asking, have we trained them for these 3 areas? We've been doing this. We've been training counselors. In fact, we had a huge substance abuse, again, from Guam Behavioral Health last week. And in the school-based mental health, the question was asked, what is the role of a school counselor? And the role is they're a catch for all. They asked another question was, okay, what kind of assessments? And they said, well, we're not going to get into specific assessments. I don't do this alone. Our people deserve the best. And that's why these evidence-based screeners are actually the ones that were chosen with the help in consultation with the technical assistance from people from UCLA, from Los Angeles District and Florida. So I just want to explain that they don't do, Senator and Madam Chair, it really is thought out. That has been in place. And we do.
I'm not trying to, we're here to seek clarity. We're not okay? Sure. We're not doing anything else. Just in chapter 12, right? You have the page 183 in the SOP. We have this, the check adequacy of assessment management by completing the suicide risk assessment, right? And then in part 1, it says, it gives different levels of suicide risk, right? So in the first part, it says suicide risk low. And then it says referral to outside agency, parentheses, Guam Behavioral Health and Wellness Center is not warranted. And so I think this is what Mrs. Holleran is speaking about, where the counselors are not fit to be able to determine whether the risk is low, moderate, or high. They don't have that type of training. I think that's the concern here. And so if the risk is low, and when you know that someone is at risk for suicide, the counselor is not able to determine whether the risk is low, moderate, or high, right? And so, but we're saying it is not warranted to refer this case to an outside agency such as behavioral health. I think that's the concern for the Chapter 12. And so,
So if I may, Senator,
and
that
then,
is-
yes,
okay.
may I just finish? I'm sorry. And then, okay. And then, right underneath it, part C, it says provide daily supportive counseling until student is stabilized. So that means they have to continue to support. And then it says the school counselor shall use the Columbia Suicide Severity Rating Scale in Appendix 12-20 as needed to assess student suicide risk. So in this kind of verbiage, it's kind of the interpretation where you're saying, okay, you're going to continue to monitor this child. And then you move into the Chapter 17 where you talk about the Columbia approach, right? And it says that in order to do this technique, they need to get the informed consent of the parent, right? And so this is the concern, right? So you have these levels of assessment, but by then it's already, the child is already at risk upon the initial meet. And so they're concerned we continue to assess and assess and assess, but we should have addressed it on day one. And so that's why that's the confusion in the SOP in that sense. But please, if.
Yeah. So thank you, Senator. One of the things, if you look at Chapter 12, unfortunately with Public Law 31-202, it made it complicated, and which, thank you for the school counselors to actually brought it to our attention that you have to get an informed consent. That's a law that existed in 2012 before we even came. I wasn't aware of it, neither was anyone in the office. What I am going to say is that because we need to be compliant with the law, that 45 days is a walking and time bomb. If we say that because when you can't wait for 45 days to do an assessment, but like to take a step back, because of that law, that's why Chapter 17 is saying that we go through a CST, they eyeball this and put it in a microscope so everyone can kind of see what is happening with that student. Now, you still have to consult with the psychologists who are licensed mental health professions. And that's what determines, unfortunately, we can't do the assessment, which determines high, medium, and low. So what do? We say, okay, when they consult based on certain questions, we determine what needs to be done. Senator, if it's low risk, based on what they consult with us, we do a safety plan. A safety plan, again, provides internal, external coping skills that they identify, the students, and then they also provide resources and numbers that they can have access to. And so that is still happening. And when we say that, because sometimes, and they were trained, they're not mental health, but they were trained to actually conduct these assessments. Now, to take a step back, that Chapter 17 is addressing some of the issues that we are having, which is that 45 days. In fact, the law says no less than 45 days. We have to, one, get a consent from the parent within that 45 days. And then on the 46th day, they can actually then do assessment. By then, it's way too late. So what do we do in place? They still consult. And if it really warrants, again, we inform the parent, you do a safety plan, you inform the parent of the safety plan. And if it warrants, then you go to Guam Behavioral Health. So I could see where it's conflicting and maybe confusing, but it's really addressing some of the barriers that we are having based on Public Law 31-202. So we are doing our best. And I am going to say, Senator, again, in this collaboration, we did include them in March, and we started talking about it with the team leaders and how it was, again, feedback. So this SPAM is not just for counselors, it's really for everybody touching a student or working with a student. It guides them. And that's why we even have nurses if there's self-injury. If it's an immediate issue, they go right to the nurse. Medical takes priority. And so just to clarify, again, that's why it's so important that the team leaders gave feedback on the chapters, give back to the constituents, and then it comes back to the work team leaders. And so that was the process. But in regards to suicide, that is the struggle. We wouldn't have to, again, that chapter is created because of what we saw and what we're reading in regards and related to COVID-19 and the struggles of the online and how do we address the social emotional well-being. Thank you, Madam Chair.
Thank you, Ms. Cepeda. I want to bring up this this item in ASCA, and it says in the school counselor and suicide risk assessment, ASCA 2020, the organization's stance on mental health screeners is, if school counselors are required to use assessments, screenings, or any other instrument to determine the suicide risk, they advocate that they are never required to negate any level of risk or harm, as students may tell school counselors what they believe will get them out from scrutiny. The use of the Columbia Suicide Severity Rating Scale and suicide risk checklist required by school counselors scores the suicide risk students low risk to high risk, but school counselors should not assign a level of risk because this can ultimately negate the actual suicide risk of a student. And so this is the concern here, right? We're telling the counselors in the SOP to assign a risk, and that's in chapter 12. But we're here in this, and to use the same format, the Columbia Suicide Severity Rating. And it's saying here that school counselors should never be put in this situation to assign a risk of suicide. And so that's ultimately, that's my concern from with the SOP, right? Is we're addressing this because it's such a huge piece of our child's lives, their safety. And so are we going to fix that in the SOP? Because it says here that school counselors should not be assigning it, but in the SOP, it's telling the counselors to assign these levels of risk.
So if I may, Senator, it's a screener. And again, in the screener, in the Columbia Severity Risk Assessment, suicide risk assessment, it says yes, no, yes, no. It's the second screener on the checklist that determines high, medium, and low. Again, we are never negating it. We have to take suicide seriously. And that's why they consult with the mental health professional to determine what are those recommendations. Again, I've often, and I know I get consulted quite often, that if it warrants that, then it goes to One Behavioral Health. We're not doing any different. And again, if it's immediate, we'll send them again that they'll consult with the nurse and the principal. And if it warrants it, then they will call 911. But in regards to using the screener, we can't see them, Senator. There are only 3, now 4 of us. They are our gate, our frontline. The counselors are the frontline and the gatekeeper. And we don't see them. In fact, the teachers refer them. The counselors then need something to have, and that's what screeners are. They really help kind to tell you what direction they would go from there and what steps are needed. That's why safety plan is so important. So when it says, and I'm glad you're saying that because that was updated. The previous one indicated in their confidentiality area was that they do, again, from ASCA, is that they provide whatever needs to be done from their district with a plan. So they can do assessments provided a plan. And that's the plan we have with DOE. So again,
so you're saying that these are screeners.
They are screeners.
Okay.
Senator, they are. However, I have to mention it's mental health screeners. So they are
Okay.
screeners. These are screeners. These are not assessments to determine, and I'm going to be a mental health professional and had 15 years at Guam Behavioral Health. I'm going to say it's far more than that when we have to do a suicide assessment to determine whether admission is warranted. They are not doing that. They are determining what the risk level is and to what direction.
But do you think that if a child is contemplating suicide, do you think that the counselor should immediately refer them to a mental health professional like Guam Behavioral Health? Because the counselor is not really trained in this area?
Absolutely, Senator. And that's the reason why they are consulting with a mental health provider, Dr. Tony Cruz, myself, Sonia Pablo, and then we have a new addition, Jesse Boleto. And so that's why it's very critical, because this licensed mental health professional determines what steps and whatever the recommendations. Again, it's always to do a safety plan and inform the parent. And so that's really the key, Senator. We do give that options. And perhaps, again, I'm not sure what it is. It's probably the communication, more understanding of what, again, what the screeners are. They're not assessments, they're screeners. And the screeners do not have them diagnosed, but it helps with the steps that need to be taken.
Right. So in the letter you put, not you put, but the letter response for GDOE, when we were inquiring about the procedures for managing students at risk for suicide in Chapter 12, do not align with the procedure stated in Chapter 17 of the SPAM. So there is a little bit of conflict. Perhaps it's just the way the wording is, right? And then it says, if we go down, it says to clarify the process, school counselors are to use the critical questions found in the SPAM. It is not a screener, but questions. But we're saying that it's a screener. And then it says complete the safety plan with the student, notify parents and legal guardians, consult with the district psychologist, and provide support for students. So what I'm trying to get at is, why can't we just provide the support for the student? Because doing a safety plan and consulting with the district psychologist takes time. But even though I consult, if I'm a counselor and I consult with the district psychologist about this child that has come up to me and said, I'm thinking about committing suicide, the child is still going to go home the next day. And you only have 4 district psychologists in GDOE, right? And
Yes.
so you know the load, right? Because like COVID is just, you know, there's a heavy load now of mental health needs because of COVID. And so there's going to be a delay in service to the child during the whole process of 1, 2, 3, and 4 before they get the support.
So
my
actually,
question is can you just perhaps just think about it a little bit and maybe make an amendment to it where we can just get that child the support they need immediately?
sure, Senator. Again, it's an open discussion. That's why we get the work team leaders done. Again, this is a process, because I do know when I hear counselors say 10 sessions are too long, that's why our SOP reflected 5. So, and again, those are supports. School counselors can only do brief counseling. They can't do long-term, and that's therapy. So even just the scope of work and knowing the difference between interventions versus sessions, I think that's where we need to be clear. And I don't think a lot of people are. So yes, absolutely. I think that's that. And we're always open. This is not a set in stone document. It evolves because of the needs of our students. And so when you talk about this, definitely we are going to talk with the work team leaders, see how we can make this a better document to address the needs of the student. And it evolves. So it's a working document that every year is revised to really address the needs of our student. And so, Senator, again, this is something we do. So yes, absolutely.
Thank you, Mr. Peter, because, you know, when I was teaching at GDOE, I came across a student that had rope burns on his neck, and I asked him, I said, what's going on? And he really didn't want to tell me. And so I referred him to a counselor, and the counselor immediately called behavioral health so that the child can seek assistance, but also, of course, called the parents. But it was important because, if the child is already going that far to put himself in that situation, I think it should be something that's warranted, where you get immediate service. And we all know that we only have 4 district psychologists at GDOE, and there must be a backlog because of the mental health needs that was impacted by COVID. And so if we could get
Senator.
some of these steps reconsidered to address that, immediate support for the child, I think
Senator,
would go a long way. Yes,
if I could add, I just wanted to add on one point, which is the reason why you have a very active team of district school psychologists is because of our experience and our work with behavioral health. If you think that school psychologists have a backlog, then you will see that at behavioral health even multiplied. The comments that
absolutely, Mr. Superintendent.
Yeah.
I'm not saying that they're not doing their job. They're
No,
working.
no.
But I'm just
No,
saying.
what I'm saying is
must
that the
have
comments.
these challenges in our community as a result of COVID, right?
Yeah, no,
And
what I was saying was, yeah, no, I didn't. No, I'm not implying that. What I'm saying is that the reason we built up the team of psychologists at DOE is to provide that support within DOE, because of the fact that at behavioral health, when I first came on board, I mean, the comments from behavioral health were, number one, a lot of over referrals to the behavioral health, a lot of referrals where students had difficulties, following up because of transportation and other issues. And so I do have to take responsibility for that. I made the decision to invest in having a strong team of district school psychologists to provide that internal support. So I think that's part of the reason why the referrals don't go out immediately to behavioral health, because behavioral health has, indicated it has, and I'm sure it's the same, they have a backlog of cases. Sometimes the referrals that they get, they sometimes wonder why they're being referred at a certain stage. And also, again, the students who get referred don't often avail themselves of services for whatever barriers that are in place. So I think that's something that we also want to keep in mind. And I'm again happy to look at this issue and make the necessary changes that are needed. But again, I just want to make clear that the reason why we've built the team of psychologists to provide GDOE specific support is, we really don't want to lose our kids by referring them out and then not having them be able to follow up or have the necessary capacity there. So that's really the intent, and I'm hoping that that intent can be fulfilled. So that's just my only comment.
Okay, and thank you for that, Mr. Superintendent, for seeing that need. I think it was a wise decision to do.
May I speak? May I
Yes,
speak?
yes.
Okay, just this past Saturday, we had the candlelight memorial service, and we had the director, Civis Ariola. She spoke to us, and she said, she guaranteed that anytime we send students or people at risk, they have enough staff to address this, because she herself, she's very concerned about what's going on. So I think that if we do have concerns saying that they're overloaded or things like that, from what I heard from her, she said that they have enough staff and they will always be there for the students. So I think that I mean, I'm just so passionate about this. When I was at school, I would even bring the student to mental health and wait with the student and the parent. So I believe that when you first see your student, the school counselor or the school nurse, you connect with the student, and then you communicate, and then you do your care. So this is a process that doesn't really take that time. If the student is confident and you're able to embrace and to gain trust and rapport, the student will open up to you. And indeed, again, like as I said, time is so precious. You cannot wait to, days and weeks or sessions or whatever. I think that if they exhibit cardinal signs and symptoms, even the way they talk or the way their body language is, I think we should take it seriously. We cannot say, oh, she's just low risk or not immediate danger. We always have to take it seriously. That's the way I feel about this. Thank you.
Thank you, Ms. Holleran. And then can I just bring up another, on page 279, chapter 17, it's direct, it seems like the direct language is pulled from ASCA. Number 4 and 5, provides short-term counseling and crisis intervention focused on mental health or situational concerns, such as grief or difficult transitions, and provide referrals to school and community resources that treat mental health issues, such as suicidal ideation, violence, abuse, and depression, with the intent of removing barriers to learning and helping the student return to the classroom. And this is why we say, we wrote the letter and said that chapter 17 did not align with chapter 12, because it shows that they're supposed to refer the child out, but in chapter 12, there was a process before the child gets immediate support. And so that's what we were talking about.
Senator, can I respond to that? Thank you. Actually, because of that law, and I am so glad this is definitely a barrier. We don't want to lose the student. So with this, that is the reason why they have a CST, a child study team, that actually looks at that student, and they become in our radar. We had to make some adjustments because of this law. If it wasn't for this law in existence, we would immediately get an informed consent based on the law. But unfortunately, Senator, that's where we were trying to think of how do we work around those 45 days. And so with that,
well, then let's just change the law.
Senator, I absolutely agree with you. I've actually approached you about this because I've had parents say, why can't I? Well, it's the law. And so, Senator, since you said that, please, we need you and the other senators to really work on this, because it's an injustice to our students, right, and to the parents and the community. So I ask for, since we have other senators here, that's exactly, please change this law.
Okay, yes, I think that's the issue here. I forgive me, I don't recall us ever meeting to discuss this, but no, I would like to continue this dialogue then. And I think that this will bring some resolve into the concerns that are in the SOP, right? And so you let me know when you're available, and we can continue this. We can have a working session to see how we navigate and what changes need to be made in the law so that we ensure that students with suicide ideation get support immediatty. And as a matter of fact, I understand that they just got another grant. We just received another grant addressing suicide for 10 to 24-year-olds, right? And so I think this is an opportune time that we address this so that we can ensure that our children get the support immediately, that they need not have to dialogue with the counselors and so forth. Okay, I'm glad this resonates. So we will be contacting you, Mr. Superintendent, and Ms. Cepeda. And we did have a meeting with some of the counselors last night. They did have some requests. separate to this, right? And so we will be writing you a letter of the summary, and we'll see what we can collaborate with. And of course, this is your call. You are the leader of this agency. So I'm not going to step on your toes in that case, but I look forward to the dialogue. Okay. And I think with that being said, maybe we can just recess to another time so that we can bring forward the work that will come out from this working session and provide the immediate support to our children. Colleagues, so we're just going to recess. I know you might have some questions, so can you please just table that for the next time? Perhaps we'll come back in a month or so, and we'll have something concrete to address, okay? I want to thank all of the students here and the GDOE staff and team, and thank you, Mr. Superintendent, for being here, and thank you, school counselors, for all that you do. And Ms. Holloran, thank you also for providing some insight and perspective on this matter. So we will recess this hearing. It is now 7:30 in the evening, and we will be in touch with GDOE to seek a resolve. Thank you very much, and God bless you. Have a good evening. Good
Thank you,
night.
Senator.
Night.
Have a good night.
Thank